So we offer three sedation options. So the first one being nitrous oxide or laughing gas. Uh, that's typically for people that are a little nervous about being in the chair, don't have to have a ton of work done. It takes the edge off, makes you more comfortable being in the chair to get the work that you needed done. But again, you're still very much awake, you're aware, you're able to drive home, you're just not as nervous about being in the chair. Second option would be what's called oral sedation. That's where you have to have someone bring you in about an hour before we do any work. We give you a medication called trazlam. It has two effects. It makes you super drowsy, and it has an amnesia effect as well, so you don't really remember being here. That's a great option for people that are, really nervous about having any sort of care done, or if we have to do any sort of advanced surgery. Again, it just makes you significantly more comfortable. I'd say that is what we use probably 99% of the time. In some rare cases, if you're just absolutely terrified of being in the chair, being in the office, we do work with an anesthesia group where they can come in and provide IV sedation, where you're completely out and you won't even know what's going on or remember being here for any of the treatment. We see patients all the time, whether they're nervous about dental work or not, that want to have sedation done. Again, it's all about comfort. Our number one goal is to keep you comfortable. Again, we know how invasive dentistry is, and so the more we can just kind of put you at ease so you can get the work done that you need to get done, the better. Again, we don't provide any sort of judgment at our office. We understand everyone has their own situation, so it's a totally normal thing, and we see patients of all types that opt for sedation. So some procedures, I'd say the most common ones that we do sedation for are removal of wisdom teeth, root canals, dental implant placement, basically the more invasive procedures that, again, you're going to be here for probably a couple hours. And again, it's something that's a bit more invasive and people get a bit more nervous about. And again, our number one goal is just to keep you comfortable. But I would say those would be the top three. It makes a world of difference. We're able to get in and do, again, very invasive procedures and have you be comfortable. Obviously, anxiety and fear of the dentist is a big roadblock for people to get the care that they need. And this is one tool that we have that allows us to get you in and do the work and have you be comfortable while doing it. So the safety measures that we take with sedation really revolve around oral sedation and IV sedation. Either one, you're going to be hooked up to a monitor that's tracking your vitals throughout the procedure. And again, if you're having IV sedation done, we do have a professional anesthesiologist chairside with you that's going to be monitoring you throughout the procedure. We do sedation a lot on patients that initially need a lot of work done, and then we have them come in, we do the sedation, we get all that work done, and then once we get you kind of back to a more routine regimen of coming in every 6 months, you're going to find that you don't need as much work done, so we don't really have to do sedation. And you may also find that you're just more comfortable being in the chair, and you find that you don't need the sedation to be done at that point. The most important step there is kind of that initial consult appointment, talking through with the patient, their level of comfort being in the dental chair, how invasive the work is going to be, and, kind of feeling out, just how anxious they actually are. Again, if it's more basic routine work like fillings or crowns and, the patient is somewhat anxious but not absolutely terrified, that's where laughing gas kind of comes more into play. But again, if it's a significant amount of work or it's a lot of surgery involved or root canals involved, again, that's where we lean much more towards the oral sedation versus IV sedation options. And again, the picking between those two really comes down to just how nervous and scared the patient is, and that's all assessed at the sedation consult.